New Congress, same debate. We're talking about health care reform. Republicans set out to fulfill their campaign promise to repeal President Obama's reform law. The effort was a success in the Republican majority House, but it could hit a dead end in the Senate. Carl Cameron has more.
ObamaCare created what we all despise and know won't work.
Impassioned Democrats railed against repeal.
This is life and death. This is the security of your family. This is whether or not you can change jobs. This is whether or not your children will be protected. This is whether or not your parents will be able to afford their prescription drugs.
The Congress can do better in terms of replacing Obamacare with common sense reforms that will bring down the cost of health insurance and expand access for more Americans.
Republicans say Obamacare failed to do that and complain that the democratically controlled Senate is flatly ignoring the will of the voters last year and the House of Representatives now by refusing to even consider repeal.
The American people deserve to see a vote in the Senate, and the Senate ought not be a place that legislation goes into a dead end. And that's the point here. We're talking about doing things for the American people, delivering results. The pledge was to repeal Obamacare. Why? Because it's going to increase spending, increase taxes, and destroy jobs in America.
Republicans can also withhold funds for the reform law, delaying implementation and forcing Democrats to keep defending their votes.
They will seek to defund. We will work to defend. We believe that defending this piece of legislation is one of the most important things we can do.
Joining me now for more, Jennifer Kim, who is an advocate for New Jersey Public Interest Research Group, and Paul Tyahla, Executive Director of the Common Sense Institute of New Jersey. Now, Jennifer, you believe that the health care reform law would be too expensive to repeal. Why is that?
Yeah, with all the debate that's happening in Washington right now, I think a lot of consumers and businesses in New Jersey have been wondering, what does this repeal effort mean for them? And so we released a report last week that looked at the facts and definitely determined that any repeal of the federal health care law would increase costs significantly for consumers and businesses. So, for example, if you get your coverage through your employer, you and your employer would have to shoulder an additional $3,000 or more in health care costs. If you buy your coverage on the individual market, your costs would go up 20% or more for the same coverage. And if you're a small business owner, instead of getting a tax credit that'll help you cover some of those costs for a typical employee plan, you'd have to pay that much more in taxes. So, in this economy, the last thing people need is all those things, rising costs. So we definitely repeal would be the wrong thing to do.
What about you, Paul?
The plan is $770 billion in new taxes over the next 10 years. And while it would be expensive to repeal, there's no plan out there that says, well, let's repeal this and then forget that the whole health care discussion never happened. There's two parts to this. There was a vote on Tuesday to repeal the health care law, and there were committee hearings on Thursday as to what to replace it with. And that's really where there's a good opportunity for reform, and we can address some of those issues that are such as high cost, both on the individual market and on the employer market. And that's really where this debate needs to go, not just on the repeal, but what we replace it with.
But don't you think the new Congress should be talking about something new and moving forward rather than continuing to talk about this?
I think the American people spoke pretty clearly that this isn't something that they support when they elected that new Congress over the objections of those who had supported health care reform in the past. And this is an important issue for the American people because it has a huge impact on the economy. It's 17% of the overall economic activity in this country. So it's completely related to the economy. It's completely related to jobs in this country. And that's why it's very important that Congress address it soon, and I'm glad that they did it in their first few weeks.
Jen, Paul brings up a valid point. Congress was listening to the American people. Should Congress be listening to the American people?
Well, I think that, the health care law that was passed last year was definitely a huge victory for consumers, and anything that isn't moving forward and, talking about how to implement this law on the state level, is a disservice. And again, it will just only increase costs for consumers. And it is right to talk about health care in terms of, how it can help the economy. Our study showed that if the law is repealed, New Jersey will lose over 10,000 jobs a year. And, there's about 165,000 small businesses in New Jersey that will be hurt, if they don't get these tax credits and other benefits that the small businesses would be getting under the new law.
What actual options are better than the current law?
Well, there are a number of them. One idea that's been moving around Washington for years that never got a lot of traction was allowing small businesses to bind together across state lines. That way they can buy their insurance en masse and they can take advantage of the same economics of scale that large companies do. Allowing bona fide associations to sell health insurance. That way, if you're a member of your local Rotary Club, you can buy health insurance through them. Then, if you lose your job, you don't necessarily lose your health insurance because you wouldn't be thrown out of those other associations where you could buy them through. Yeah, and there's some things in this law that are worthwhile and that we can keep and that can be transported into a new law. But let's have an honest discussion about it. You know, one of the good things in this is the need to take care of kids who are born, especially those who are born with chronic illnesses. But we can do that through direct subsidies and have an honest discussion about it. Instead, we have this insurance scheme and we're subsidizing people through the insurance program instead of just having an honest debate as to what it's going to cost and moving forward from there.
Now, the repeal may have passed in the House, but it'll probably be voted down, or it's going to have a difficult time in the Senate. And, of course, the President's also said he's going to repeal it. So isn't it just political theater?
Well, again, I think any discussion around healthcare that isn't how can we move forward in the states and actually implement it on a state level that's going to help people here in New Jersey is moving backwards instead of moving forward. And Paul brings up a couple of important things that we actually kind of like the idea of small businesses being able to pool their purchasing power together, and that's actually one of the things that the state of New Jersey needs to take up right now. And we'd be we're very excited that state lawmakers have started to do that. But something that was written into the federal law that was passed that is really great is the idea of building a state health exchange in the state of New Jersey.
Political theater, yes or no, Paul?
I can count to 50, and I know that this isn't going to pass the Senate, but it's something that Republicans campaigned on, and so they're delivering on a campaign promise. And it also gets this discussion restarted as to what real health care reform would look like over a long period and not something that's rushed through the way it was in the last Congress.
But you say a discussion, so that just says talk, 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 talk.
Well, it's politics, so there's going to be some talking. But there are members of the Senate who voted for the overall package last year that didn't like particular parts of it. And that's where there's an opportunity to really get some legitimate reform through.
Okay. Thank you both so very much for joining us.
Thanks for having me.